Catholic Charities of the Diocese of Raleigh wants to ensure safety is the highest priority as we continue to operate during COVID-19. This video will provide hand washing and infection control best practices as directed by the CDC. As Catholics, we often turn to saints as role models and for inspiration. In the US, we can look to the wonderful example of St. Marianne Cope. In 1883, while serving as the Superior General of her order, she responded to a plea from King Kalakaua of Hawaii to care for leprosy sufferers in Hawaii. A few months later, Mother Marianne arrived with 6 other sisters and proceeded to found hospitals and care for the sick. During the entire course of her lifetime, none of the sisters working under Mother Marianne's direction was ever stricken with leprosy or any other communicable disease. St. Marianne, aided by the Holy Spirit and armed with an advanced knowledge of infection control practices, was an internationally regarded pioneer in medical care. She provides us with an excellent example for our work here to care for those in need while protecting God's servants so they can continue His work uninterrupted. Our main objective at this time is to stop the spread of COVID-19. When thinking about the importance of infection control and stopping the spread, we should recall how COVID-19 spreads. The virus can spread by way of respiratory droplets in coughs and sneezes. We would also like to note that small droplets can stay airborne for prolonged periods of time. Another way the virus can spread is through contact with surfaces on which droplets land. In this presentation, we will focus on hand washing and surface disinfection as the main methods for infection control. In the next presentation, we will explain social distancing, which should be also practiced during this time per federal, state, and local government recommendations. Remember, 21 to 39% of infected people do not appear sick but can still spread infection, which is why infection control is so very important. We'll first talk about hand washing, and some of our tips are to hand wash for at least 20 seconds with soap and water. A tip is to pray the Our Father slowly to measure these 20 seconds. Remember to wash your thumbs, in between fingers, the backs of your hands, and your wrists. If soap and water are not available, use hand sanitizer with at least 60% alcohol and rub all surfaces of your hands until they are completely dry. Please ensure you wash your hands after blowing your nose, coughing, or sneezing, after using the restroom, before eating or preparing food, after touching common surfaces, before and after providing routine care for another person who needs assistance, like a child, and every few hours just for good measure. Also, we really want to emphasize to please avoid touching your eyes, nose, and mouth after contact with frequently used surfaces such as door handles, cell phones, light switches, etc. This is the way that the virus can easily spread into your own respiratory system. There has been a lot of misunderstanding about how gloves protect people from infection. Medical gloves are used to prevent cross-contamination. This is primarily useful when medical staff are moving from one patient to another patient. It's also practical when medical staff are moving from sterile areas to non-sterile areas. In each case, the medical provider will put on gloves before coming in contact with the first patient and then removing the gloves when that patient contact is complete. The provider will then wash their hands and put on a second pair of gloves before interacting with the next patient. This primarily protects the patients, not the person wearing the gloves. However, if blood or other bodily fluids are involved, the gloves do protect both the provider and the patient. For the purpose of COVID-19 infection control, gloves offer very little protection. There is some evidence that gloves worn by the general public may increase the spread of infectious material by increasing the instance of cross-contamination. Gloves should always be removed before hand washing, and washing your hands while wearing gloves is inappropriate in most circumstances. While gloves are not considered helpful for controlling the spread of COVID-19, they may still be required by certain food handling regulations. If you are working in an area where gloves are required for food handling, you must still follow the food handling requirements, and you must remove your gloves and wash your hands once an hour. Face masks have been a controversial topic in the United States since early February. We know that COVID-19 may spread more easily than first thought, including by asymptomatic or pre-symptomatic carriers of the virus. There is some evidence that COVID-19 may spread by simple airborne transmission in non-healthcare settings. These findings have led some call for universal mask usage among the general public. On April 3rd, the CDC issued a new recommendation about face masks. In this recommendation, the CDC recommended face masks be worn when people are in close contact with another, especially in places where there is significant local spread of COVID-19. To more thoroughly address the questions and best practices about face masks, we have prepared a separate presentation. That presentation will help you understand the best practices of homemade mask creations and how to wear a mask in an effective and safe way. Even with this new mask guidance, social distancing requirements and good hand hygiene remain the most important ways that we can contain the spread of COVID-19. Wearing a mask does not change or diminish the need to practice effective social distancing in public. In fact, masks without social distancing would do little to stop the spread of the virus. We'll cover this topic in greater depth in another presentation. Please practice disinfecting frequently touched surfaces such as tables, doorknobs, light switches, countertops, handles, desks, phones, keyboards, and toilets, faucets, and sinks. First, clean the area and then disinfect with one of the following methods: 5 tablespoons of bleach per 1 gallon of water, or 4 teaspoons of bleach per quart of water. Remember to never mix with ammonia or other cleaners. Alcohol solutions with at least 70% alcohol. Over 350 household disinfectants are also effective. Please check the EPA registered list found on the CDC website and follow manufacturer instructions. Other measures that you can include are to cover your coughs and sneezes with a tissue, avoid touching your face, which includes your eyes, nose, and mouth, avoid crowds and close contact. There will be more on the social distancing video to follow. Again, we remind you that 21 to 39% of cases do not show symptoms, so it is important to diligently follow these infection control measures. Proper hand washing, social distancing, and infection control are the best actions you can take to stop the spread of COVID-19. Catholic Charities are implementing our own infection control policies. For group warehouse workers, which means 2 or more volunteers are working in the same area, hand washing will be required once per hour for each person, also required after any direct personal contact with another person. Stagger hand washing breaks so that there isn't a line or group at the sink. Social distancing. Allow for a 6 feet circle around each person. Never enter someone else's 6-foot zone. Social distancing is required whether the individuals are fellow volunteers, staff, or guests. Cleaning. Disinfect all surfaces and items at the start of your work and pause once per hour to clean all common surfaces in your work area. Remember to clean carts and other non-stationary items as well. For the safety of volunteers, staff, and guests, the adherence to the following policies is mandatory. The infection control policies for parking lot and solo interviewers, which includes individuals working by themselves or groups of people who live in the same household who are not working together in the same area. Hand washing will be required once an hour for each person, also required after any direct personal contact with another person. Social distancing. Allow for a 6-foot circle around each person who enters your workspace. This includes guests or staff who are not part of your family. Family members do not need a social distance from one another if they live in the same house. Cleaning. Disinfect all surfaces and items at the start of your work and at the end of your work. If anyone enters your workspace, pause to disinfect all common areas after they exit. Again, for the safety of volunteers, staff, and guests, adherence to the following policies is mandatory. The following individuals are asked to postpone their on-site volunteer service until the end of the COVID-19 pandemic for their good and for the protection of others. This includes healthcare workers, first responders, anyone at high risk for negative complications, and anyone who spends time with or cares for people who are at high risk. The following individuals are asked to postpone their on-site volunteer service until the recommended self-quarantine found below is complete. Any travelers who have left the diocese must self-quarantine for 20 days from their return. Anyone who has been exposed to COVID-19 is recommended to self-quarantine for 14 days from their last date of exposure. Anyone who lives with or cares for someone who has COVID-19 is recommended to self-quarantine for 14 days after that person is considered negative or recovered. Anyone who has not practiced social distancing and has had contact with more than 10 people, excluding cohabitants, is recommended to self-quarantine for 14 days after group contact. Anyone who is sick with a respiratory illness of any type is recommended to self-quarantine for 14 days after their symptoms resolve.